We are reading about the phagocytosis. Okay, uh, as the term you can see that phago and two cytosis. Okay, phago means just for eating or engulfing. Okay, and cystosis means cell. So engulfing of the particles like solid substances such as bacteria. Okay, and tissues etc., warm tissues and etc. is called phagocytosis. Okay, neutrophils and monocytes engulf pathogens which may enter the body and protect us against diseases. So mainly whenever you got a cut or injured himself, okay, so you found that after some days there are some whitey substance, just you can say that accumulate at that place. Okay, so you can understand that these are the WBCs or phagocytosis, which are just fight out, okay, that and no one bacteria can enter in your body. So mainly the work to provide us immunity and you can say resistant against bacteria is provided by these phagocytosis. So by this process, so leukocytes have the property to sequence through the walls of capillaries. Okay, it is known as diapedices at the site of injury to fight with the pathogens. Okay, the killed leukocytes or dead WBCs pass out of wounds together with tissue called as pus. Okay, which I am just trying to elaborate you that it is called pus. So an abnormal increase in WBC count indicates some infection in the body. Okay, so if there are abnormal increasement, if you see in WBCs, it means there are some infection in the body. So now how the formation of antibodies and antitoxins take place. Okay, I hope you just uh, remember the word antibodies and you can hear it about many times. So lymphocytes produce antibodies. Okay, so lymphocytes are the sites for producing antibodies. So they combat with the antigens or pathogens. Mainly, what you can see the example of coronavirus that it is a antigen, okay, which is outsider for our body. Okay, and antibodies are some substances which are produced inside our body to fight with that antigen. Okay, so antigen or they are also called as pathogens. So they combat with the antigens or pathogens and protect the body against specific diseases. Okay, so if you see, acidophils and basophils produce antitoxins that neutralize the toxins and protect the body. So antitoxins are produced by acidophils, by about which we just read in last week, and basophils produce antitoxins that neutralize the toxins and produce the and protect the body. When disease-causing germs gain entry into the substances called toxins or poisons. Okay, if some foreign particles or poisonous substances enter into our body, these are known as toxins or poisons. Antibodies act as antitoxins. Okay, whenever terms comes anti means opposite. Okay, so you can say that they are just they are just a fight up with these toxins, so that's why known as antitoxins, as the name antibiotics. Okay, whenever you see the term antibiotic tablets are nowadays used more often, so you can see that they combat with the bacteria, that's why they are known as antibiotics. So antitoxins to neutralize or detoxify the poisonous effect of toxins. Now next point is immunity. So resistance of the body against diseases is called immunity. I hope nowadays this term you maybe wrote every time, okay, because many famous word is nowadays. So resistance of the body against diseases is called immunity. Lymphocytes are responsible to provide immunity against specific diseases. Next term is come inflammation. Okay, increased local heat, okay, redness, swelling, and pain due to reaction of tissues to injury, and localized invasion of germs is called inflammation. Okay, inflammation, if in local term we just said that it is just related with the swelling. Okay, so here WBCs, especially the and neutrophils monocytes and neutrophils show diapedicis, okay, and fight against the disease causing germs. Okay, so in inflammation also WBCs has the main role, and in WBCs also mainly monocytes and neutrophils show to fight up against the disease causing germs. So now there is given lifespan of leukocytes. Okay, so average lifespan of leukocytes is about 1 week. Okay, mainly 7 days are the life cycle for the WBCs, if in one word says, and for RBCs it is 120 days. Okay, whenever you are reading, if you compare uh, in between two things, so it is easy to learn anything. Okay, so you can understand well, and whenever you need to write or to say something, so you can easily say. Next is blood platelets or thrombocytes. They are the smallest sized, okay, corpuscles, all the three, okay, corpus species. Their number varies from 2 lakh to 3 lakh per millimeter cube of blood. Okay, and their size is about just 3 to 4 mu in diameter. Okay, they denucleated. I already told you D means we can say that where no, okay, nucleated. Okay, without nucleus. They are also produced, okay, in bone marrow from some giant cells called megakaryocytosis. Okay, mainly they are mainly you can say produce in spleen only. Okay, some parts also you can say that produce in bone marrow also. Functions of platelets are: the blood platelets are responsible for the clotting of blood, okay, during injuries, and blood platelets on disintegration produce a chemical called thromboplastin or thrombokinase. Okay, it initiates the chain reaction involved in blood clotting. Okay, when you read about blood clotting, then you will more understand these things. So blood is the river of life. Why it is called a river of life? Because evaluating various functions of blood, okay, in a nutshell, say the blood is the river of life. Okay, all the necessary life are distributed to various body parts. Okay, and harmful substances are removed from them by way of blood, by keeps on flowing like a river in the body. Okay, you can easily understand that only blood is a thing. Okay, and you can say it's a little bit amount of water also, but mainly blood is every time you can say flowing over our body, okay, inside our body. So it is called as river in the body, okay, which is just used for excretion of harmful substances from the body. One word is coming here, that hemopoiesis. So production of blood corpuscles is called hemopoiesis. Okay, so blood corpuscles, if their production is known as hemopoiesis, the tissue that produces these blood corpuscles is called hemopoietic tissue. Okay, so this is a new information for you. Or if we read about the blood clotting. So in first step, okay, you can see that at the site of injury, okay, thrombokinase, also called thromboplastin, is replaced by the disintegration of blood platelets and injured tissue cell. Okay, as you can just see on your book also, that in which just schematic representation of blood clotting is given. Okay, these are blood platelets. Okay, injured tissues are there, in which thrombokinase is formed. Okay, in blood platelets form the platelet thrombokinase. Okay, as we move on the step by step, you can match with the diagram also this. So thrombokinase, which acts as an enzyme, and calcium ion present in plasma convert inactive plasma protein prothrombin into active form called thrombin. Okay, when there is no need to our body, it is just in the form of prothrombin by the action of these calcium ions. Okay, so for blood clotting, sometimes this question also asked which mineral is required. So calcium is required for the blood clotting because it initiates the conversion of prothrombin into thrombin. The activity needs calcium ions and some plasma factors. Okay, so you can match this with as it just in prothrombokinase will be you can see here inactive, and by the action of these calcium ion it convert into active thrombin. Next step is soluble plasma protein fibrinogen is converted into soluble protein called fibrin with the help of thrombin. Now the action of this thrombin comes. This active thrombin, okay, act on this soluble fibrinogen and it convert it into fibrin which is insoluble. By the polymerization, the fibrin protein forms long fibrin threads. Okay, these fibrin threads form a very fine network or mesh. It is called fine network called mesh at the site of injury. Okay, blood cells get entangled in this network and form a clot. Okay, just imagine that whenever you got a cut, how the clot is take place there. So you can understand well. A clot is formed at the injury within 2 to 6 minutes. So you can also see sometime soon after, okay, its formation, the clot starts contracting and squeezes out rest of the plasma which is in the form of a clear liquid, the serum. So you can, if you match with the this is schematic representation, okay, so fibrin is converted into fibers by by the process of polymerization and networks of fibers, okay, plus entangled blood cells which forms the clot. Okay, so you can understand by this process. Okay, now if you see here that anticoagulants are the substances which prevent clotting of blood are called anti coagulants. Okay, so sodium citrate are used as anticoagulants. Okay, heparin our blood, okay, you can easily understand that if blood coming outside from our body, it is just clotted, but our inside our body it is not freezes out. It is just because of this heparin. Okay, it is you can say that it is a hormone which just which is found in our blood. Okay, and in salivary glands of leachage are known as anticoagulants. It is also said here that why does blood not clot within the blood vessels? The blood contain an anticoagulant called heparin. Okay, it is antithrombin that does not allow the formation of thrombokinase within the blood vessels. Okay, that's why our blood is not clot in our body. Next is blood blisters. Blood blisters are formed without the blood coming in contact with air. Okay, these may be formed due to injuries like sharp pinch when the skin does not break. Next is defibrinated blood. Okay, blood from which fibrin has been removed is called defibrinated blood. It consists of serum and formed elements and does not clot. Okay, next is coagulated blood. Take some blood in a test tube. Clot can be seen formed in usual way. The serum which squeezes out from the clot and gets collected on the surface. Next is platelets in blood clotting. Okay, if platelets fall to a very low count, coagulation occurs very slowly and can lead to hemorrhage. Okay, so this you can say that if platelets falls to very low count. Okay, in anemia mainly platelets found to be very low. Okay, so many other problems will arise due to this platelets if platelets goes down. Hemophilia or bleeder disease. I hope you already know the term hemophilia. Okay, you can read about it in the chapter genetics also. It is a genetic disorder, okay, in which blood fails to clot when it comes out of the blood vessels through any injury. Okay, clotting of blood requires some factors. Okay, the absence of any one factor may cause this disease. Okay, mainly hemophilia disease goes from a mother to his son. Okay, in female, if it has a daughter, it only act as a carrier. Okay, I hope you remind these all things from the chapter genetics. So, blood transfusion and blood groups. Okay, now we talk about the blood transfusion and blood groups. Sometimes it becomes necessary to give transfusion of blood to a patient to combat severe blood loss in an accident, some diseases, or in surgical operation. Okay, this is called blood transfusion. Okay, whenever you already read about and heard about these terms. Okay, blood donation, etc. Okay, it is you can say that good for health also if you donate your blood regularly, if you are happy and healthy. So, blood transfusion from an individual to the vein of another appears to have been attempted in Europe as early as 17th century. Okay, so it is the history about it. So it is started in 17th century in England, sorry, in Europe. So, but before the discovery of blood groups, okay, blood transfusion frequently resulted in a patient death. Okay, then it was Carl Landsteiner in 1900 who discovered that the blood of individuals differed chemically. The clumping of red blood corpuscles, okay, or it is called as agglutinations, okay, occurred when the blood of different chemical types was mixed with. So Landsteiner recognized, okay, as you know that Landsteiner also uh, tell us about the blood groups, okay, from which we also got the Nobel Prize also for their discovery. So Landsteiner recognized two types of antigens, okay, that is A and B, and two types of antibodies, that is small a and B. The antigens are present on the plasma membrane of RBCs, whereas antibodies are present in the plasma. Okay, so the red blood corpuscles of an individual may possess either antigen A or antigen B, or both the antigens, or none of them. So it is distribution of antigens which determines the type of antibodies in the blood. Okay, all types of antibodies and antigens and antibodies cannot coexist or are not compatible. Okay, antigen A is not compatible with antibody small a or antibody A. Okay, but compatible with antibody B. Similarly, antigen B is incompatible with antibody B or antibody B, okay, small b, so but compatible with antibody A. So you can say that their homologous structures are not they are not compatible with their own antibody. Okay, thus if you see here, A and small b can exist together, but and so B and small a, the antigens A and B can occur together if they're antagonistic antibodies. Okay, small a and B are lacking if you see there. Similarly, antibodies A, small a and B can exist together if their antagonistic antigens A and B are absent. Depending upon the distribution of antigens and antibodies in the blood, Landsteiner, okay, in 1900 classified the blood into three groups, whereas the fourth blood group was reported by De Castello and Sterling, okay, 2 years later. Okay, he just divide three groups, and fourth group blood group is reported by these two. So the four types of blood groups are named according to the type or types of antigens present and are A, B, okay, A, B, and O. In blood transfusion, the antigen of donor should be compatible or matching with the antibody of the recipient. Okay, whenever you go into the hospital, they just match first the blood groups. Okay, then they donate to the recipient. Otherwise, the corpuscles of blood donated become agglutinated, as we read it about earlier, and block the blood vessels. It may prove fatal for a recipient. A person can receive or donate blood to the other blood groups as given in table 7.2. So now you can understand that various blood groups, okay, their composition and transfusion. So you can see that blood group, okay, in them antigen present A and antibody present B. This is important for all of you that can donate blood to A and B. Okay, so you can match with your own blood groups also. Okay, can receive blood from A and O, and blood group B has the antigen capital B and antibody is small a. Okay, it can donate blood to B and AB, and it can receive from B and O. So AB can donate antibody is not present in AB. Okay, AB blood group, and it can donate only to AB group, and it can receive from all. Okay, it is universal recipient. AB blood group is universal recipient, and blood group O is universal donor. You all know this. Okay, now you can match with your own blood, and you can see that to which type of blood group you can donate. ABO system. Okay, besides transfusion of one's own type of blood, the other possible transfusion can be made as follows. Okay, you can also match this type of who can give or receive. Okay, universal donor, it can give to A also, B also, okay, to AB also, like that. And it is AB, which is universal recipient, it can take blood from A also, B also, from O also. Okay, like this you can match these possible transfusions. RH factor. Blood of most people contains a substance called RH factor, which was first discovered in our common rhesus monkey. This RH factor is found in 85% of white population and 93% of Indian population. Okay, a person is said to be RH positive. Okay, when its RBC contain Rh antigen, and Rh negative if he has no Rh antigen on his RBCs normally. The blood of the Rh negative person does not carry any antibody that can react with this antigen, but such antibodies are produced if Rs negative blood comes across Rh positive blood. In such cases, the transfused Rh positive blood acts as foreign bodies to the Rh negative person. Okay, his body proceeds to produce antibodies called anti-Rh to destroy the transfusion Rh positive and red blood corpuscles. Okay, mainly this Rh factor is used during the pregnancy. Okay, which is uh, cannot be harmful for the newborn baby. So first doctor just determine this Rh factor, it is positive or negative. So his body proceeds to produce antibodies called anti-Rh to destroy the transfused Rh positive red blood corpuscles. First transfusion okay is not opted to be serious, but repeated transfusion may result in severe reaction and ultimately lead to death of Rh negative person. Okay, mainly in Indian, we can say that mainly Rh positive persons are found, only a few persons are Rh negative. So okay, this also given here that Rh factor in pregnancy. Rh factor is very important as it is inheritable. If an Rh negative woman marries an Rh positive man and conceives an Rh positive fetus, the first baby may be safe. But following Rh positive fetuses will die in the womb or soon after birth. Okay, it is because of the factor that Rh positive fetus induces the formation of anti-Rh bodies in the Rh negative blood of mother. During first pregnancy, the formation of anti-Rh antibody is very slow and does not affect the RBCs of fetus. But in the succeeding Rh positive if you see fetus, okay, the result will be disastrous. Okay, it means death of the newborn babies, other babies. Other Rh antibodies already present to mother's blood will pass to the fetus through placenta, causing coagulation of RBCs of fetus. It may lead to the death of fetus or newborn baby. This disease is called erythroblastosis fetalis. Okay, so in you can say that all days no one knows these type of factors and etc. So the okay, so the many problems will be arise in that time. But nowadays it is compulsory to match the Rh factor. Okay.